The reason why you can't hear our voices or see our faces is fear of stigma.
These are our stories.
It's hard enough dealing with the public finding out and getting abuse from the public, but when you feel like you've come to a safe environment and you're treated with stigma, it's just twice as hard and twice as difficult to deal with.
We engaged and collaborated closely with patients, and it was their idea to use drama. They wanted to create something different, something new, and they thought drama would be the ideal way of doing this. However, they thought that using actors in a staged sort of workplace training environment, that those videos you got in the past, would never really engage with staff the way we wanted to, whereas we thought something like a theatre production would be a much better medium to do this.
Well, I was initially approached by Scottish Youth Theatre, who I'd worked with before on a number of other projects for NHS Scotland. So this was something that was familiar to me and that I wanted to get involved in.
The vision was to spark debate and open up the discussion and give out the point of view of the service users, but in an interesting and dynamic way. So engaging young people in this helped give the scenes energy.
There is no way, none whatsoever ever,
That I could, on any level,
ever be described as
prejudiced.
Some of the patient forum members and myself had seen some other productions of Scottish Youth Theatre done, and we really liked how their minimal staging and how their stripped back production made you focus in on the words and emotions that were part of the scene, and we thought that would really work well for what we were hoping to achieve.
The process was that we went along to a kind of information sharing session with some senior medical experts who just tried to bring us up to speed about the biology and the mechanics of HIV. And then there was a kind of sharing session with service users from the Brownlee and also with some of the young actors who were going to be involved in the project. And that was a great session, and I got a lot of information from that.
And can you tell me how the stigma shows itself? The symptoms?
Well,
To start with,
there's
the look. Oh, yes, that is worrying.
Well, at first when I found out about it, I was really excited because, it was a new project and I was getting to work with my friends and it sounded a lot of fun. And then we got to meet the people who are living with HIV and we heard their stories, and I think straight away we realised how important this project was and how special it would be.
When we had a session with the service users and the young people, it was so open and honest and really delved quite deep into some of these people's experiences and some of the things that they're having to live with that, to be honest, you don't consider when you're not living with it.
I didn't realise we still lived in a society where people thought that you could catch HIV just by shaking someone's hand.
Hearing the experience of the service users was actually made me quite angry. In that initial session, that sharing session, there was a lot of humour, there was a lot of warmth in the room, but I took verbatim notes, and when I went back and looked at them in isolation, away from the warmth of the experience, you could see the anger just leaping off the page at you.
And then you want to shout.
shout in their faces.
Shout right in their smug, scared faces.
In my role, I regularly receive reports of incidents of stigma and discrimination within services, and it happens across all settings, sectors and specialties and staff grades. And the thing is, like the clip says, it's an easy fix. It's lack of knowledge, or lack of up-to-date knowledge especially, that drives the fear that creates the stigma.
Seeing as how you're his caregiver, trainee admittedly, should you not be doing something about, the blood apparently gushing from his open wound?
Were you not listening? He's got HIV.
All I knew about HIV was what I'd learnt from biology in school. So I knew what the virus was, I knew how it attacks cells, I knew how it affects someone, but I had no clue as to how it affects people living with it in a totally different way. I'd always thought about HIV as something I had to learn about to pass my exams, and now I think about it as something that can really affect someone else's life.
I think this is an incredibly important piece of work because it's speaking for a group of people who are the experts in their own HIV, but also in their own experiences, and to try and encapsulate what they're saying and put that back and open that up, and helping them do that in an interesting way and in a dynamic way.
I'm very proud of it. I'm very pleased to have been part of it. I think that the way it's come together in quite a collaborative way is a really good exemplar of how you should work in these kind of situations.
The H in HIV does not stand for homosexual, horrible, hereditary, or even hoaching.
Well, what does it stand for then?
Human!
The use of humour in them exaggerates some of the attitudes and prejudices that you find, but the service users were very clear that they didn't think it went overboard.
I thought the scenes were excellent. They truly reflected and validated the lived experiences of people with HIV and the stigma and discrimination that they can sometimes face when they attend healthcare services.
They were hard hitting, and it brought it all back to you when you were first diagnosed, which makes it very, very, very hard to deal with again, because you're going back to square one.
Powerful, emotional, all sorts of emotions going through my head, and nearly in tears, and it took me back to these situations and reminded me of them vividly.
And the thing is that they showed the fear that sometimes is apparent when people are attending healthcare services, and that goes against what healthcare services should be about. Healthcare should be a safe and welcoming place.
You feel goggles and a mask are necessary?
Too bloody right.
And how many pairs of gloves?
Just the 2, but that's only because there was only 2 in the box.
Apart from making the process more difficult, just how do you think those extra and quite unnecessary precautions might make the patient feel?
Don't know, don't care. All I know is it makes me feel a hell of a lot better.
Ultimately, we would like to see a reduction in stigma and discrimination within our services. We hope they raise awareness, we hope they create discussion and provoke thought across staff, but also beyond that, we would like to empower other patients to feel more confident in being able to challenge stigma and discrimination at source, and to know that there's support available to help them to do this.
It's an important conversation to have, not just for the people living with HIV, not just for the healthcare profession, but actually just to be talking about HIV at all is really important, and to include that younger generation in it and getting them really invigorated by it and wanting to do the project justice has hopefully sparked conversation in their lives and with their peers, and it can actually reach much further than maybe what we initially intended.
I would like to thank NHS Greater Glasgow and Clyde for funding this piece of work and showing real commitment in tackling stigma and discrimination within their services. And I'd also like to thank the patients who've been involved in the process. Their commitment and courage has been inspirational and the key driving force behind it.